medical professionals, from current medical professionals, students, educators, and even a first lady. We're really going to have a real conversation. You're about to you can put your questions for our Q&A session at the end in the Q&A section of the webinar. And also we want you to hashtag. I'm learning about hashtags, okay? I want to, Cassandra's proud of me. I want you to hashtag Good Health Wins as well as NCNW DelVal. And we will put that as well so that you can see that. Now, our moderators tonight are in the truest vein of what Maya Angelou called phenomenal women. These young women came on board to deal with my craziness and all the rest of us craziness, and has shown us how to do what we need to do with the technology as well as structuring the program. The first moderator is a young lady by the name of, who's actually a colleague of mine at Arcadia University, Miss Janae Hawthorne. And with nearly 10 years of experience with the city of Philadelphia's public health and the behavioral health department, Janae has recently accepted a visiting professor role. I'm gonna make sure y'all understand this. A visiting professor role at Arcadia University within the Department of Public Health. That is quite an honor, quite an honor. She is currently a doctoral student within Johns Hopkins program, Dr. PH program, majoring in health policy. And we need us in health policy because we already know that there's a disproportionate of folks who look like us who are getting COVID. Okay, in policy and management with a concentration in healthcare management and leadership. Janae received a degree in biobehavioral health from Penn State University and an MPH concentrating in epidemiology from Drexel University. Y'all give her a hand. She's a bad sister. Just give her a hand just for the hand cover. Okay. All right. Okay. When she isn't working, Janae is a co-director of the New Leaders Council in Philadelphia's chapter. She also holds memberships with the Penn State Alumni Association, the National Organization of Women, and she is a Delta Sigma Theta sorority member. So we're going to give this young woman a hand, Janae, a hand. And my soror, okay, is my other phenomenal woman, because we wanted to have a real balanced moderating session, someone medical and someone non-medical. So Cassandra Lubris is our other person. And Cassandra resides in Philadelphia. She proudly pays homage, and I hope I say this right, to Idabel, Oklahoma. Okay, I love saying that, Idabel, Oklahoma. She is currently a Lean Six Sigma black belt in the field of aviation logistics. Y'all want to hear that again? She holds, okay, she is a Lean Six Sigma black belt in the field of aviation logistics. Cassandra holds an undergraduate degree in business communication and a minor in marketing from the University of Central Oklahoma, a master's of business within concentration in marketing from LaSalle, and a master's of administration with an emphasis in logistics from Central Michigan University. And she just so happens to be a member of Alpha Kappa Alpha Sorority Incorporated, Phi Beta Omega chapter. And I love the way what she says, what she lives by. She has two quotes. Latch on to all that is good, not like your life depends on it, but because your life depends on it. And her other quote is, quiet women don't make no history. So I guess I'm going to make a lot of history, all right? So these young women are going to lead us off, and they're going to be beginning the process of this wonderful Can We Talk webinar. And everyone enjoy yourselves, get some good information, and let's go.
Thank you so much, Dr. Lori, for that wonderful introduction. I'm very excited to be here. So myself and Cassandra, we're going to introduce the panelists for today that we're going to have our conversation with. So first and foremost, we have Sierra Coppage, MA, MS. She's a certified personal trainer, all of that alphabet behind her name, is an integrative nutrition and wellness specialist who is passionate about helping folks enhance their life through diet and lifestyle change. Sierra has been a long-time community health educator and strives to make nutrition simple and easy. She offers virtual medical nutrition therapy consultations, as well as in-person visits to those who live in the DC, Maryland, or Virginia area. Shout out to the DMV. Sierra received her master's in nutrition and integrative health from Maryland University of Integrative Health. And she is also the owner of Remedy 831, where she curates natural herbal remedies. Thanks, Sierra.
All right. Good afternoon, all. Thank you so much for joining us today. Our next panelist that I will introduce is Deanna Capanella. And so some great things about Deanna. She hails from the city of brotherly love, Philadelphia, where she raised family. Excuse me one moment, my screen moved unexpectedly, so my sincere apologies. Where she was raised in a family with a strong technological background. Her background is in communications, having earned a bachelor's degree in mass communications, broadcast journalism from Norfolk State University, and working in the radio, marketing, and insurance industries. She has broadened her experience through transitioning into the technology field as one of Old Dominion University's web content and media specialists. These experiences have enabled her to have a unique background of diversity, communications, working with the public and technology.
Don't be shy, Deanna. We see you. It's fine. Next, we have Pamela Davis, who currently works for the School District of Philadelphia as a certified school nurse, K through 12, that she started in 2019. Pamela began her medical career in 1990 at the Children's Hospital of Philadelphia, also known as CHOP, as a registered medical assistant. She took advantage of the company's tuition reimbursement program to further her education and received a BSN from Eastern University in 2002 and her school nurse certification from Eastern in 2021. She worked at CHOP for 29 years, and her last position was as a clinical supervisor. She has experience as an outpatient and inpatient nurse, an operating room nurse, subspecialty practice nurse, and emergency room nurse. That's a lot. Kudos, Ms. Davis. And Pamela is a proud member of the National Association of School Nurses. Welcome, Ms. Davis.
Next, we have Dr. Christy Johnson, DO. Now, Christy Johnson, DO, MBA, is a board certified family physician who has practiced medicine in Philadelphia for 24 years. A graduate of the Philadelphia College of Osteopathic Medicine, Dr. Johnson received her postgraduate training at North Philadelphia Health System's St. Joseph's Hospital. During her career, she has served in multiple clinical and administrative positions. She is currently an associate physician at Chestnut Hill Family Practice at their practice in Wyncote, Pennsylvania. Dr. Johnson is committed to providing quality healthcare and education to the underserved pediatric, adult, and geriatric population of Philadelphia. She works daily to ensure the total well-being of her parents and the community she serves and lives in. She strives continuously to find practical ways to enhance healthcare awareness and wellness. Her passion for addressing health-related issues compels her to consistently embrace opportunities to develop comprehensive models for healthcare and advocacy. Welcome.
Next, we have Ashanti Lancaster, or I'm sorry if I mispronounced it, if it's Lancaster, you know, Philly folks, Pennsylvania folks who messed that up. But she pastors All Nations Worship Assembly in Columbus, Ohio, with her husband, Pastor Julius Lancaster. A visionary with a passion to empower millennials on life and marriage, she is also a certified life coach and serial entrepreneur. Her love of people is coupled by her exuberance to help women renew, refresh, and rediscover just how meaningful their lives are. Ashanti is married to her best friend, Pastor Julius Lancaster, with whom she shares two amazing sons, King and Zion, and a beautiful bonus daughter, Juliana. Welcome.
All right. Next, we have Richard Austin Oliver Jr. Richard Austin Oliver is a native of West Philadelphia, Pennsylvania. Currently, Richard is an aspiring candidate for the Westchester University of Pennsylvania Masters of Public Administration program. Richard is a class of 2020 graduate of East Stroudsburg University of Pennsylvania with a major in athletic training with a concentration in rehabilitation, health, and sciences. Richard is a spring 2017 initiate of the East Stroudsburg University of Pennsylvania chapter of the Mu Beta of Kappa Alpha Psi Fraternity Incorporated. Richard is currently working on the coordinator of my apologies, I did that again. It was working as a coordinator of the undergraduate and University of Affairs for Kappa Alpha Psi Fraternity Incorporated International Headquarters in North Philadelphia. Richard's other endeavors include being a mentor for the Overbrook Monarchs youth football organization based in West Philly, being a member of the Concerned Black Men of Philadelphia, being a part of the Youth Legacy Network, Youth Provision Coalition, and a member of the Delaware Valley NCNW chapter. Welcome.
Next, we have Ms. Carlina Saunders, who is a graduate of Temple University School of Nursing. She has worked for the University of Pennsylvania Health System for 27 years and was involved with Penn research with pharmaceutical companies, home care teaching, surviving HIV as a clinical RN are most significant. And of course, her son's godfather who has post-polio syndrome because his parents did not vaccinate him. She has a certificate in COVID-19 tracing from Johns Hopkins University in 2020. And she is a member of the National Black Nurses Association and the NCNW Delaware Valley section. Welcome.
Next, we have Dr. Mary Sizer. Mary currently works at Children's Hospital of Philadelphia as a nursing professional development specialist. Mary started her career at CHOP 32 years ago as a registered medical assistant. Mary followed in her mother's footsteps and went on to become a registered nurse. She received her BSN from Widener University, a master's from University of Phoenix, and her doctorate of nursing practice from Walden University, graduating summa cum laude with a 4.0 GPA. Mary is a proud member of several international historic honors societies of nursing. So thank you, welcome.
Okay. Next, we have Brandon Teal, who was born and raised in Northeast Philadelphia. He received his Bachelor's of Science in Sports Management from East Stroudsburg University. While at ESU, Brandon was involved in many organizations such as Omega Psi Phi Fraternity Incorporated and other student organizations. Brandon is a member of the DelVal section of NCNW. And he is also currently enrolled in the Westchester University Masters of Public Administration program. Outside of school, Brandon is a general manager of a semi-pro basketball team in Delaware County, Pennsylvania. And after completing his master's degree, Brandon has aspirations to pursue a career in diversity, equity, and inclusion within professional sports. Welcome, Brandon.
And finally, we have Akua Wilson. Akua Wilson is a graduating senior at the University of Cincinnati studying criminal justice and women's gender and sexuality studies. She was born and raised right here in Philadelphia and is planning to attend law school next fall. She has been involved on her campus being the first Black gay woman to run for student body president, as well as starting her own company, Dissolving Division, where she trains faculty, staff, and students on how to understand and practice empathy within academics. She also is a member of the illustrious, my organization, my soror, Alpha Kappa Alpha Sorority Incorporated. And she is excited to share her passion and knowledge with us here today. Welcome.
So we have wrapped up all of the introductions of our panelists. And like Dr. Lowry said earlier, this is not just myself and Cassandra just asking questions. This is a conversation. So with that being said, would any of the panelists like to discuss, what contributed to your decision to receive or not to receive the COVID-19 vaccine? Anyone?
I can
I'll
start.
start. Oh, go ahead.
Okay. I don't know who that was, but you can totally start if you want to.
Well, I see Akua,
ahead.
so Akua, go ahead. And whoever else was talking.
Okay, I'll just be really quick. Honestly, I did not want to get it. Like for months, I was like, I'm not getting it. Like, I'm just not getting it. And it was for me one of those things that like, this is my first like vaccine or like, health decision as an adult, right? So like when I was a kid, I didn't really have a choice to get vaccinated. It was just like your insurance says get vaccinated, so you get vaccinated, right? And so like it was like I was able to actually read the things for myself and understand for myself. And I've been to a whole bunch of these types of conversations. The job I actually used to work at, it was called Cohere. They literally do this. And so one of our topics was COVID. And so we had, I think, 8 focus groups where we would just sit there and talk about stuff like this. And so I was able to kind of get those different understandings of what was going on. And for me, it was just kind of like, I've done a lot of research and still haven't gotten many answers. And so I'm just going to chill out for a while. But in the back of my mind, I always knew that I was going to eventually have to get it. Like I know my school mandated this semester and just things like that. So like, it wasn't like I'm never going to get it. It was just like, I don't really need to rush to get it at this moment because it is so available right now that like, when I have to get it or when I want to go out of the country or when I want to do something where I'm putting other people in harm's way, then like I'll get it. And then honestly, I only got it because my mom called me and she was like, come get your vaccine. They're leaving in 15 minutes. And I was like, huh? And she kind of was just like, you're going to have to get it eventually anyway. This is easy. I'll be here. And so I was just like, okay, fine. And I was literally crying, but yeah.
Okay, thank you for that, Akua. I think that for a lot of folks that are probably on the younger end of the spectrum, Carlina.
Oh, there you are today.
Oh, I was breaking up. Okay, sorry. Carlina and then Ashanti.
Good evening, everybody. I was not hesitant at all. I remember classrooms being completely emptied in my youth. I'm a boomer. And in elementary school, chicken pox and measles, mumps, and rubella would go through the classroom, and we'd all be home for a week or until it started to clear. The other thing is living through HIV as a clinical person, no vaccine was ever available. And so I wanted to make sure that I was in risk categories. I wanted to see my family. I wanted to live. I lost people and other professionals to this terrible, terrible virus. And so I immediately, as soon as I was up and my number was ready, I rushed out, rolled up my sleeve, and away we went. So I was ready to go as soon as it was available to me.
I believe Ashanti was next, and then we can have Deanna and then Dr. Johnson.
Hello, everybody. So my decision was not immediate either. I am new to the 40 Club, so I just turned 40 in May of this year. And so I was a bit hesitant. I haven't had any vaccinations since I was made to do in school. And I've never lived through a pandemic. I've never had to concern myself with polio or any of those things. Talking to my lovely Aunt Doreen, who had to get mandated vaccines. We had conversations. I had conversations with my mom. My father, who was a diabetic, really was probably the reason why I got the vaccine. I own a commercial cleaning company. I have for about 8 or 9 years, and we clean all of the homeless shelters here in Columbus, Ohio. And they were basically mandating it for us to continue to work inside the homeless shelter. And just being in those environments, and then my father being a diabetic, and diabetics suffering at a very alarming rate from dying with COVID, I just made it my responsibility to protect him. I'm very young, very healthy. I take pretty good care of myself, take all of my vitamins, but I was really concerned about my dad, concerned about my aunt, concerned about my mom. So I took the vaccine, not so much for me, but I believe for the other people that I loved around me. I have 2 small boys, they are 7 and 9. There is no vaccine for them. And so again, because I am out all the time, traveling all the time, I just didn't want to be responsible for me being the reason why they may or may not get the COVID-19 virus. So I just did whatever I could do to protect them.
So can everybody hear me?
Yes.
You can hear me? Okay. So for me, I was very much against getting it. I'm a millennial, and my my generation seems to be very distrusting of, you know, the reasons why to get the vaccine. I come from a very liberal generation where we don't like being forced to do things. And it was just in my, you know, it was people in my family. My uncle works for the company that makes the vaccine. And it was a lot of pressure from him, you know, to get it. And he's pressured me to always get some sort of vaccine all through my life. And I like that the choice. I feel like it should always be mine, whatever that may be. So I really didn't appreciate having to get it. I only got it because I need to work. And my job, I mean, you know, forced me to get it, or I couldn't get paid. So it really put me in a compromising position where I had to do something against my own beliefs and my own wishes. And so that really is the main thing. I would not have still gotten it had I not had to.
I appreciate your candor, Deanna, I really do. Dr. Johnson and then Brandon.
Good evening, everyone. Even as a physician, I'm a scientist just by nature. So when the vaccine first came out, I was lucky, but not lucky. I work in healthcare, but luckily I'm in a controlled environment. My office, we made the necessary modifications to kind of prevent too many people being around each other at the same time to avoid the risk of exposure. And the health system that I work for, they were offering the shot. But because I'm a healthcare worker and I knew that the people who were in the hospitals, those truly, truly on the front line needed it before I did, I just took my time to get it. But in doing that, it allowed me to research the immunizations. And because I'm a scientist, I base my response to everything on facts. I don't go on fiction. I don't go on myths. I don't go on rumor. Give me the facts. Let me read the information. Then I'll make a decision on my own. And after reading the information and seeing what had been going on in society with COVID and the deaths and the totality that it was impacting, not just on the patients who were in the hospitals, the patients whose family members were affected, those who were getting disease and having long-term effects of it, I just made a decision like, you know what, for safety for myself, I'm by myself. I don't have any children, but I do have family, and I didn't want to put anyone else at risk, and I wanted to protect myself the best way I possibly can. Yes, I know that the shot does not guarantee that you won't get it, but the likelihood of me getting it and ending up in the hospital is less. So that was what I based my decision on.
Thank you, Dr. Johnson. And last but not least, Brandon, before we move on to the second question.
So when the vaccine first came out, I have an ego problem. So I don't like when people try to tell me what to do. So when the government was trying to kind of peer pressure people or kind of make it incentivized to kind of come out with a vaccine, it was kind of alarming to me. However, I do see the benefits of getting a vaccine, but as of right now, since I kind of don't have, I'm not around many people that much, so it's not really like a top of my priority list. So I think as a person who's kind of really strict on wearing a mask and kind of making sure their hands is clean and social distance, until that starts to not be able to be as beneficial, I choose not to get the vaccine until then.
Excellent. Thank you. Thank you all for your responses to our first question of the night. It sounds like people have all taken such diverse journeys on deciding what path to go forward. And so thankfully, you all have been able to stand behind your choices. And so going on to our next question, and this can be open to any one of our panelists. Did you receive the MMR, that's the measles, mumps, and rubella, and the varicella, which is the chickenpox vaccines as a child? Is there a difference between receiving those vaccines and receiving the COVID-19 vaccine? And I will open the floor to any of our panelists that's interested in responding. Looks like I saw Ashanti's hand first.
Thanks so much. So yes, I absolutely received the MMR. So when I was in, I believe, middle school, I was one of the first, I don't know to call it even a generation, where it had to be required to go to school was the MMR. So I had no choice. My parents had no choice. I went to Columbus Public Schools. So yep, I received that MMR. It's crazy because my best friend received the MMR too. When we were seniors in high school, she still got the mumps, which was kind of odd because we had the vaccine for it. As far as chickenpox goes, no, I did not receive that vaccination. I ended up getting chickenpox when I was older, and it was terrible. Like I had them in my mouth, on the bottom of my feet, my hands, and my eyes. Wherever there was skin, that's where I had chickenpox at. I did not receive that vaccine. In my opinion, the difference is I didn't necessarily have a choice because I was under the age of 18 when I received both. So I didn't have a choice in the MMR. Got chickenpox when I was about 14. Again, I was a minor. I don't know if I would have, had a right to say if I received that vaccine or not. Not sure why my parents didn't get me that vaccine either. For me, that's the difference. I think the difference now is the era in which COVID is happening. You have generations that are more privy to much more information than there was even back when I received the MMR. We did not have social media. The internet was just beginning. Cell phones were not a thing, you know what I mean, in the 90s. And so here we are now in 2020 when COVID first came, and you're just dealing with a different demographic of minds. And I believe that that's, plays a lot into the hesitancy, is just more knowledge is available about those things. But no, Ashante was little when she got it, had no choice.
Thank you, Ashante. Let's go to Dr. Johnson.
So I'm of the generation where the MMR was available, but the varicella was not. Varicella vaccine didn't come out to 1995, and I'm a little bit older than that. So I didn't get the varicella vaccine, but I got chickenpox, and I got immunity from it from that. Did that make an impact on my decision to get the COVID vaccine? Actually, no, it didn't. And again, because I'm family medicine, I see peds, I see adults, and I have the conversation. I have patients whose families are anti-vaxxers. I have the dialogue with them about vaccines, the benefits, and try to address their concerns to the best I can. But it definitely did impact my decision to do it again. Once I knew the facts, it was a very easy decision for me to make to get it.
Excellent. Thank you so much for that account, Dr. Johnson. And I'll move over to Carlina. But beforehand, I just want to read a comment from the chat quickly. And maybe this might impact how you are describing your answer. So from Jovita Hill, my grandchildren cannot visit me, even though they are vaccinated. And because I know my risk aversion and their risk aversion is not the same as mine. I don't want to socialize with unvaccinated people. I don't want to socialize with people who travel or go to bars or dining establishments. I'm glad that my millennial and Gen Z and Gen X children and grandchildren recognize that their senior parents and grandparents need to be protected by these vaccines. And let's go on to Carlina next for your comment.
I wanted to go back to part of what was in my bio. My son's godfather could have gotten the polio vaccine. He did not. His parents elected not to have him receive that. When I met him about 40 years ago, we're both boomers. He was walking. He worked for the government. He was an auditor. He flew all over the country. He now has post-polio syndrome. And this is a concern about long-term effects of COVID. We don't know what they're going to be. But at this point, he is wheelchair bound. He is in excruciating pain. He is not the person that I met and became friends with 40 years ago. So his stand was immediately, since I know what happens when you don't get vaccinated, I am pro-vaccination. His daughter is a millennial, and they had a huge fight about it. She finally did get vaccinated, but he is a living example of long-term effects in a boomer who did not get the polio vaccine. Just wanted to put that out there that, again, we don't know if you get COVID and you survive it, what your long-term effects might be. That would be a concern for me if I got it. Thank you.
Thank you. It might be good to point out that some people that are against the vaccine believe that we don't know what the long-term effects of getting the vaccine are as well. And so I know that that's just been a long-term conversation, and hopefully we have the answers to both of these sooner than later, right? Let's move over to Akua. What are your thoughts?
Yeah, I thought that was actually super interesting to like tie into what I was saying, just because I love listening to these conversations because you understand like people's personal experiences weigh a lot into like how they view things and like how they react to things. And so like, it's not really this like, you know, one size fits all, either get it or you don't, right? Like there's so many reasons. And I think while it's super interesting that like you have that personal experience of like somebody close to you seeing the, you know, bad effects of not getting a vaccine, I think a lot of people are like now highlighting the effects of getting vaccines, right? So like we think back to like the Tuskegee experiment and things like that, and like how like they have used vaccines and government, you know, mass weapons of control basically to do things like sterilize our community. And so like I think it's just really, really interesting when you like look at stuff like that. And so it's like it's almost like a lose-lose situation here, right? It's like if we don't get it, we're going to get demonized by society, and we're going to, you know, be, you know, have all these other side effects. But if you do get it, you're going to be controlled by society, and you might have long-term effects that may be different, but they still may be just as impactful. So I thought that was super interesting. And then just to go back to the question a little bit, I have no clue if I got those vaccines, which I think is like the point, you know, which I think is like the idea, right? So like, I feel like for me, my parents, especially like when you don't know about like the medical field, or like you don't have a lot of people close to you that are in the medical field telling you what's in these vaccines, what vaccines are, why we need vaccines, things like that. We just kind of develop, especially as a black community, this, okay, if we're all doing it, we're all just going to do it, right? So like vaccines just are normalized because our kids have to go to school with vaccines. So we never really question why we're having vaccines or why we're taking vaccines. And I think this generation, like Shantae was saying, with like social media and stuff like that, is now highlighting like, what is a vaccine? Why are we taking these vaccines? What are we doing? What is in this vaccine, right? And so now people are bringing up all these questions where now those same people who may not have had that information may not be getting, you know, true information, or may not be getting false information, but they're getting this information from these different sources, and they're able to make a decision that goes off of like what they've seen or what their experiences are, rather than, you know, word of mouth or what their parents did or something like that.
Thank you.
So, Cassandra, I'm sorry.
Please.
So before, I know we have We have Carlina, Deanna, and Sierra that are waiting to talk. But I just want to clarify something really, really quickly. I think that this is something that our folks in particular like to always talk about. They talk about Tuskegee, right? So I just want to clarify some misconceptions. So with the Tuskegee experiment, the experiment wasn't that they gave these men syphilis, right? So these men already had syphilis, and the research study was to basically observe the long-lasting impact of syphilis on the body, right? And so I think the misconception is that people believe that these researchers gave these men syphilis. They did not give them. What they did do, which is what the issue is that they withheld the treatment for syphilis. So these men were coming to these doctors thinking that they were getting treatment for syphilis, and they were getting a placebo. So for all of our folks, I know that there are some doctors out here that already know that, but I just wanted to clarify that because that is something that our folks always talk about. Tuskegee, sometimes they confuse it with the Tuskegee Airmen. So I just want to clarify what that study was actually about and just the misconceptions behind it, and just want to clarify for folks. So thank you, Cassandra, and I want to give it back to Carlina. Thank you.
I'm so sorry. I promise this will take 30 seconds and I'm not going to cut anybody else off. But that is so true. I was literally just talking about this the other day because I joke a lot about like, I want the white people vaccine. Like that's like my favorite line when I'm like, if I'm going to get my vaccine, or like if I'm talking to people about the vaccine, it's like, oh, it's fine. Like I'll get it as long as I get the white people one. Right. And so like, I think like with that being said, like there's so many people that think like that. And there's this idea and this like real idea, this real fear that like, we're not getting the same vaccine, right? The vaccines that are in our communities, that are at our CVSs, that are at our clinics are not the same ones that are in these hospitals that people are paying thousands of dollars for, which to clarify, hopefully. Sorry.
Thank you. No, thank you for adding that. I'm hoping to go over to Dr. Coppage. And can you please make sure that, am I pronouncing your last name correctly?
Yes, it's Coppage. Doctor, not yet, but I received that. So
it's coming. There we go. All right.
So in regards to my response to this particular question, I think as a society as a whole, what makes kind of the decision around COVID-19 vaccination for certain people is that collectively there's like this consciousness that we've come to, you know, and there's a questioning of certain things that, you know, we are receiving as far as information. We are now understanding like, okay, it may be important for me to ask these questions when I go to the doctor instead of just accepting, you know, medical advice for what it is at face value. And so we're now more actively engaged in our health. And so I think that is also one of the reasons why it makes the whole COVID-19 vaccination decision, you know, a huge thing. It's like, well, you know, we are also now holding people accountable as well. You know, there's an accountability here with our own experiences that we have experienced with the medical field. And I think to this day that Black and brown folk are experiencing despite, you know, it being 2021. And so I think that is the reason behind it. And I think one of the things that we also have to address, which is the need for transparency, right? Because just as well, you know, we could possibly, you know, die from getting COVID, we also have to address the fact that there is a such thing as vaccine injury, and it does happen. And so I think it's important for us to also, you know, discuss that. And though the risk may be small, we have to look at the risk from both sides of the spectrum.
Thank you. Thank you very much. Excellent points. How about Deanna?
So I do believe that I did get the measles, definitely the measles, mumps, and rubella. I did not get the chickenpox vaccine, but I did get chickenpox at a very young age. I'm going to piggyback actually pretty much on just about everybody that has said something, because it's kind of like we are much more conscious of the things, the good and the bad things that we put on our bodies. So there was a lot of distrust that happened with it. You know, I didn't really want to, I came around to it a little bit more once I realized it was FDA approved, fully FDA approved. And there was a difference. Oh, there's emergency vaccine. And I'm like, well, what is that about? What is an emergency vaccine versus a full, and like I said, my uncle works and he explained the whole process to me and it made a lot of sense, but I was still iffy on why isn't there an emergency flu vaccine? Why isn't there all these other emergency ones? And why is there a COVID one? I understand we're in a pandemic, but the flu is year round. You can catch it for the most part. I also, and this goes back to being a millennial, about there's a really big push for it to get it in a lot of social media and it's like everywhere you look, there's some kind of push. It's being thrown in your face everywhere. It's being like, it's put down your throat basically. And it's kind of like, that's all you're talking about is getting it. But to Sierra's point, what about the information about the side effects and all these other things? We want that just as readily available as the push to get it, so that, because for me, that would help me make my decision. If you want to get something out of me, I need to know all of these side effects, just like all these other drugs, they tell the positive and the negative side effects. I need to know that up front, and I shouldn't have to wait until I'm actually about to get the vaccine to know, oh, well, you may have X, Y, and Z. I want to know that on the commercial. I want to know that on social media, like wherever I'm seeing it.
Excellent point. I kept saying, like, I need the whole story. So don't just tell me the part that makes you feel better or feel good about trying to encourage me to get it. I want to hear from Carlina, but before Carlina, I'm hoping to get some thoughts from Richard on this one.
Can you repeat the question, please? This makes sure I want to be on the right track. I don't want to be off track.
No,
I sent this.
We prefer you not be off track, so we're on the same page. Not that you could be. I think you're great. Did you receive the MMR? That's the measles, mumps, and rubella, and the varicella, which is the chickenpox vaccines as a child. Is there a difference between receiving those vaccines and the COVID-19 vaccine?
I can speak from that perspective. I did have all those vaccine shots. I believe my mom and dad wasn't anti-vax. I went to a Catholic school from kindergarten to 8th grade, and they required all the vaccinations. And I even want to say when I went up to college, East Stroudsburg, they even asked for the same vaccinations to see if I was vaccinated. And I also think it was one vaccination I was missing, and I got it when I was 18. But I really don't see no difference. I think what my generation see is how fast the vaccine was made compared to like the MMR and everything else. It been steady in a sense. They think the vaccine came out fast, but it's also COVID-19 been around and the scientists been studying it. That's how the vaccine was able to come about in a fast time turnaround. But people don't look at it that COVID-19 been around. They just see it in my generation as, oh, it's a new strain. We got a vaccine rolled out and it's not approved officially. But man, I don't see no difference. But again, I believe everybody have their own choice to get vaccinated. I ain't vaccinated because I didn't want to cause any harm to my mom, my dad, because they all have compromised immunization, or as well as my grandparents. And I also kind of wanted to go outside in a sense. So my mom wasn't letting me outside until I got vaccinated. So I got vaccinated to go outside, truthfully.
Man, how real is that? Like this, I don't know about you all, but I am an extrovert of the extrovert. And so having to be inside for this past year has been brutal.
It was horrible.
I think that is probably the thing that tipped the decision for me. So good point. Let's hear from Carlina.
Two very quick points. One, sources of information. Many millennials do not have a relationship with a physician. And that's important for you to discuss and get your information from a healthcare provider rather than Instagram and the internet. That's the first thing. The second thing is I worked at the University of Pennsylvania Hospital for 30 years. 12 years ago, a physician and a PhD started working on this vaccine. And unfortunately, people think it was developed quickly. It was not developed quickly. They worked on it for 10 to 12 years. They pushed it more quickly to bring it to the public because of the deaths and the issues that were going on where so many people were dying. So I've heard a lot that it came up so fast. It didn't come up fast, and you should always, always, always have the conversation about your concerns, what your questions are with the healthcare provider who knows you, not just Dr. Google and WebMD. I'm done.
Well, Carlene, I actually have a follow-up question for you because I think you bring up a really great point in that I think that the generation before me, I think, had a physician or a family doctor or something like that. I think that a lot of younger people, not only do they not have full-time jobs and therefore don't have healthcare insurance, but even if they can find like a local public health location, like they just don't have the time to go there, or they don't know who to go to kind of get that relationship formed. And so my question is maybe around something that Deanna brought up was getting the information out there. And so maybe was there a better opportunity or more of an area of opportunity for the public relations side of defining what exactly was happening with the vaccine, describing to people that it's not new, that it's been around. I think millions of people just didn't know that because the conversation was, here's this new thing and it's only kind of approved, but we're going to like try to push it through. So what do you think about that?
Well, I think it was politicized. That's the first thing. This is a health issue that should not have been politicized. The second thing is the CDC was totally unclear as far as what I can see. They would give one mandate this week, they would give a second mandate the next week. The next week was you wear a mask, but you don't wear. There were too many ifs, ands, and buts, and it caused nothing but confusion. It should have come out clean. It should have come out once. They should have said, everybody put a mask on. No ifs, ands, and buts. It was too confusing, and people didn't know which group they were in and what they were supposed to do. Yes, there are health centers. Generally, if you work, you can't get there, but your health is important. And the best thing to do is always know your baseline. You may be 25, but you need to know what your blood work is. And my docs are on here, so they need to back me up on this one. You need to know where you're starting. Are you low on sodium? Are you high on sodium? What about your family history? Who died of cancer? How old were they? You need to know, and unfortunately, many times we hide stuff. We don't tell you who died of what, okay? But even at a young age, you need to know, you need to have a copy of your vaccinations. You need to know what your family history is. You need to know what the predisposition for your health is. But you need to start knowing where you're starting, and you need to start around 25 and knowing you may be 25, but you need to know you're healthy. You can't take life and health for granted.
Excellent. Thank you so much. Such great discussion thus far. I don't want to hog the whole conversation, so I'm going to take one more person to talk a little bit about if you received the MMR, if you received I'm just trying to look to see what the second one was, chickenpox, and what the difference was, and maybe if we can hear from Dr. Johnson about that.
I already chimed in on the MMR vaccine. I did get it, but I wanted to kind of make a comment on the importance of prioritizing your health. I think we as a culture do not prioritize our health. We're so busy working, we're so busy taking care of family, we're so busy taking care of community, we fail to take care of ourselves. And that's where we fall short. Even as a physician, I go to the doctor once a year. I'm okay. I'll see you again next year. If you just do that, you are light years ahead of a lot of people. And what happens at 25 may not necessarily happen at 45, but you have already, you know where your foundation is. And that's the same when it comes to when you consider having conversations and communications with a physician. If you don't have a relationship with the physician, it's very hard to have that dialogue and actually believe what that person is telling you. So it's really important to kind of make those connections. And I always tell people, even if you don't have that connection with someone who's a primary, there are a lot of resources out there. There are a lot of people who are willing to have the dialogue with you. You just have to kind of be forthright in saying, this is information that I want to need. Where can I go to kind of find it?
Excellent wrap up. That's a great point. Thank you so much. Over to you, Janae, for our next question.
Thanks, Cassandra. So many things that I wanted to comment on, but I just want to say that thank you, Dr. Lowry, for matching me and Cassandra up, because I'm an introvert. So when we went on lockdown, I was in heaven. Like, I didn't have to go anywhere, didn't have to talk to anyone. But I can definitely say that being in quarantine definitely helped me to focus on my self-care. So I definitely appreciated the folks that put that in the chat. So we definitely talked a lot about just how the push for the COVID-19 vaccine was so different compared to like the flu, HPV, other things like that. So I kind of want to switch gears to, we talked a little bit about distrust, right? So what is one thing that the government could do for the Black community, Black and Brown folks, to truly change this cycle of distrust? Because I know that for myself in particular, me getting all of these credentials and my folks still don't trust me when I say certain things, how can we break that cycle of mistrust in our community? I think Akua is the first person to want to answer this question.
Yes, I've literally tried to answer this question like 6 times since the beginning of this summer because of those COVID conversations. And the only answer I can come up with is just leave us alone. Now, let me like make that very clear. When I mean leave us alone, like I mean the government, and unfortunately the government and the, medical system are very deeply intertwined, but more Black doctors for more Black patients. Like a point that I was going to make last time, but I didn't get a chance to, is that like, we don't go to the doctor, like one, yes, because we don't have time and, we're just barely getting to adulthood and it's just a lot. And then 2 is that like when I do go to the doctor, especially because I live in Ohio, I get treated like I am just the scum of the earth. And I have never experienced that in my entire life when I was in Philly. Like I go to the doctor in Philly and it's no problem. They're probably Black, at least the ones that I go to, and they do what I need to do. They tell me what I need to know and I keep it pushing, just like somebody was saying. But I think like while I'm here and like, I guess that's the broader America, right? Because not everywhere is a very densely populated place with Black people. But what happens is that like we do have these negative experiences. And so we just like never go back, right? Or we just associate that negative experience with the fact that I have to go to the doctor. So now every time I think about going to the doctor, I'm going to be upset, or I'm not going to want to go, or I'm going to put it off, which is unfortunately also putting my health off. So I just think for the government specifically, like there were too many commercials that had Black people in it, too many. I have never seen this many commercials with Black people in it in my entire 21 years of living. I haven't. And this year, now every commercial want to have Black people in it, get vaccinated. It's like, why do you care so much now? And I think that was a lot of my distrust, is that like, okay, yeah, people, are always going to push vaccinations. That's what's going to happen. But they have not really pushed it on the Black community like this in a while, right? They don't push health on the Black community. They don't push positive things on the Black community. They don't care. They don't care. And so like, they're acting like they do, right? And they're taking on this stage of like, let's push it to Black people because they're unvaccinated. And so it's like, what do you want us to do? Like, you want us to trust you, but we can't trust you. And then we get demonized for not trusting you. Like it's just the situation where we're just kind of stuck, because if we do trust you, we're probably going to get, excuse my language, screwed over. But if we don't trust you, something's probably going to happen to us anyway. And so it's like, what am I supposed to do here? And so, yeah, I just think the government needs to leave us alone for a while. Like, give us time to recuperate, give us time to, figure life out, figure out the fact that we're under all this oppression. And then on top of that, we got to worry about the public health crisis that we're going through, right? Like, give us a second, like, let us come to that. Give us at least information, right? Like, give us information and that's it. Don't push anything on us. Don't tell us what to do. Don't tell us what not to do. just give us the resources and let us make our own decisions as individual people.
All right, I definitely can appreciate your response. So I want to go to Ashanti and then Deanna.
Okay, so I love my cousins so much. You need to come to Columbus where there are more Black doctors and not in Cincinnati. I will say that. So this is a really dope question. I have a lot of things I'm gonna say in a very, very short amount of time. So it's not going to come from the government, period, point blank. That is too big of a machine. They are not going to ever care about Black people and brown people. But I will say this, I feel like the push of the vaccine in those communities in particular is because they knew that socioeconomically we were so screwed, is why we were dying at such a faster rate, because we do not have health insurance, because we have terrible diets, because we are living food deserts. There were so many domino effect things that were affecting Black and brown communities. I feel like the government knew that they had to try to get Black and brown people vaccinated faster than anyone else because our death rate was just ridiculous. It was at levels that you were not seeing in other communities. So I think what happens though, and I am like an edge millennial, I think what happens is that when you do that, we don't trust you, because the question is why? Why are you ain't never cared about us before, why you care now? It's not that I care, right? It's just that y'all are dying at a fast rate and it's because of my hands. Like the government knows that the reason why Black and brown communities are dying faster is because of redlining, Jim Crow, slavery, you name it, it's at their hand. So I kind of felt like they had no choice, but then it looked crazy because y'all ain't never cared. Now all of a sudden y'all care. I'll say that. And to be honest, so because the government is not going to help us, I believe it's community. Like we as a community of people, like there's so many amazing women right now that are Black doctors that Black people do not trust. Like I'm a whole Black MD, and you believe that the government's paying me to say what I'm saying. So disregard my science, disregard my work, disregard everything that all these hours that I've put in, my dissertations, disregard all of that. You think the government's paying me to tell you to get the vaccine. And I think that just comes from us as a community. Our bottom has fallen out. And so I love like hearing these boomers. I love the boomers because I feel like that's wisdom. I do not know everything. I think I know everything as a millennial, and Alpha is even worse because they're the YouTube generation. They know everything. And I think what happens is because I have all of this access to information at the palm of my hands, right? I'm an organ trail baby, but I'm also the Nextel generation that learned about the chirp cell phone all in one person. So I kind of live in this odd world where I don't know everything, but I can figure it out. Where the boomers have lived life, right? They have overcame some things that I will never, because of them, have to endure. So I love being able to get wisdom from them because they're able to tell us like grandmothers are important, right? Aunties, uncles, if you have them available, they are important. And I think that as a community, our infrastructure is broken. So you don't really even have that family dynamic anymore in Black communities. And so you have single moms, or you have just like people running around, and now they're getting, and I know I'm stepping on the next question, disinformation and misinformation. Nobody trusts anybody. So the government's out the window. Like they're not coming for us. But the question now is, how do we come for each other? Like how, as we as a community, how do we begin to rebuild trust within each other so that when Black nutritionists speak, we listen because we have diabetes, right? So the reason why y'all dying from COVID faster is because y'all's diets are trash, right? So you don't want to get the vaccine. Well, you got to put the Doritos down too. So I think that there has to be this marriage of trust and love in our community with each other, and no dependence on the government because they abandoned us from the beginning of time. They're not thinking about us. They tried to make it right. They tried to wash the blood off their hands by pushing a bunch of commercials and giving us $100 per shot. Ohio was giving away $1 million. You hear me? $1 million.
My school is still doing raffles for that to this day.
Free education.
$2,000, $5,000.
That's creepy. Like that's creepy. Like I don't trust you. Why you give me $1 million? Because I I put y'all in this situation and it's the least I could do to get you out, but it looks creepy to a millennial generation. So I just want the community back. You know what I mean? I was raised with my grandparents. They raised me up. And so my endearment, I think, to just older generations, they are full of wisdom. I want to work on community. I want to work on the church doing a better job in community. I want to work on those things because our bottom is falling out. And I think if we begin to repair community, we will be able to repair trust.
And I think, I'm sorry, Deanna, that kind of reminds me of like the Black Doctors COVID Consortium here in Philly, and where we had a Black doctor, Alice Stanford. Well, she went to Penn State, but she is an AKA. And so I think a lot of people, a lot of Black and Brown folks in Philly, myself included, actually went to the Black Doctors COVID Consortium to get our vaccinations just because we trusted her and all of the Black doctors and all of the Black nurses that were going into different communities that most of the government, and I work for the government, so most of the government was not going into to provide these resources to the folks that really needed it. And I think that there was a comment in the chat where they were talking about how also you know, a lot of Black folks live in densely populated areas. So that's also something that we have to take into consideration, especially if you're not able to properly social distance, if you have multiple generations in the same household, things like that. So a lot of great points. Thank you for that, Ashanti. And then lastly, we have Kiara.
So I'm gonna touch on actually a couple different things that were said to connect it in. I definitely think that what can be done is, actually Ashanti made a good point, is that it does need to come from the community. It's going to come from the government, regardless of whether we want it to or not. It's going to. I just think that, and this is something that is so overlooked, I'm very big on first having all Black doctors, like from the top to the bottom, all of my doctors, so my therapist down to my primary care. Only thing I don't have is Black dentists, and I'm working on that. So it's huge for me. And I have a good relationship with all of them. 2 months before I moved to Philadelphia, I was talking to my primary care there to try to find one here. So, you know, I was very big on that. And I think that that is a major thing because it did help to build trust with my doctor. And what I'm going to say is COVID fatigue. We already are dealing with so much mentally. This is weighing extremely heavily on a lot of people. And the more that you're stuffing stuff down us, the less that we want to do, because we just need a break. We want to just breathe. So going from not having it mandated to mandated now, it's just it's levels to it. And now we're just kind of like, we have to worry about our health. We have to worry about seeing the doctor. We have to worry about getting an appointment to see the doctor. We have to worry about getting a shot. It's so many things that I can only speak for me and my generation of people, that mental health is a huge thing for us. And having to deal with COVID, I've seen people turn into so many different types of people. So it's kind of like, to Akua's point of just leaving us alone for a second, just let us breathe. And then let's pick up this conversation with the community, like Ashanti said, because we trust our own people a lot more than we tend to trust our doctors. Because unless they are a part of our community as well, it's my experience. So it's kind of like there's a factor that's not being thought of by a lot of people, and it's the mental health factor that you're not even going to get in here because there's so much other things happening here already.
Sierra?
Okay, so I think initially when I heard the question, my response, the first thing that came to mind, honestly, was letting us have a seat at the table. And I think in some ways that this may be addressed in like policy and, in public health policy, but I think in dealing with like the community that I work with, there, and specifically at my organization, you have these people that are in suits, white folk making decisions about Black and brown people, but haven't even talked to the people to see what really is best for them. And so I think it's important. One, I don't really know if the trust will ever be fixed, or if it really can truly be fixed, just because of our relation to the country as a whole, right? However, I think it's important for us to have a seat at the table and also acknowledge the fact that, and a lot of times in decisions that are made, money is like the root, and a lot of things, it's surrounding money, it's involving money, and it's a business. The United States is a business, a corporation. And I think if we kind of address some of those things, we address the root cause of poverty, we talk about some of those things, I think in unpacking that and addressing some of that stuff, it may be a lot easier for people to be trusting of, say, the government or the healthcare industry. I don't know, that's kind of just what came up for me, but I think that's a really loaded question. And to be honest, I just don't ever know if we'll ever get to that point until we just address some basic things. We can't, like, can we address people's basic needs first? You know what I mean? Like, let's do that. And then maybe people can kind of come to the table and begin to trust others. But if I'm worried about how I'm going to eat, how I'm going to be able to find a place to live, if I'm thinking about some of those things, it's going to be hard for me to be even worried about trusting you and your advice.
Thank you for that, Sierra. And I think that that's very valid. And it kind of goes to my point where it's like having a seat at the table, having folks from our neighborhoods that look like us, that have those credentials, that are also impacting that policy. Because I've sat in too many conference rooms for the government where they're like, oh, we're going to have this initiative. And it's just like, well, whether it's about HIV or it's about PrEP or it's about anything, did you even have anybody that's a part of this community at the table? Because this final product does not look like it. And that's why these programs aren't working. This is another conversation to be had, but we have, in public health in particular, there are so many white women, but that's another conversation that we can have. Okay, Dr. Johnson, and then Ashanti, I think you put your hand up again.
So I'm going to try to hit a couple of things. I know Chris mentioned the government leaving us alone. Unfortunately, this is a pandemic. It's a worldwide phenomena. The government is not going to leave us alone. They're not going anywhere. COVID is not going anywhere soon. And unfortunately, because they've had so many deaths on their hands, they have got to do something. So leaving us alone is not going to happen. And so often I hear us say, we need a seat at the table. We need a seat at the table. I'm of the mindset, I create my own table. I don't have to sit at your table. I know what my community needs. I'm going to get like-minded people of my own, and we're going to address the needs of our community. And if we have to go to the government or to private organizations or get funding to make it happen, just like Ala did, that's what we need to be more focused on, instead of looking for the government to do it for us, because they're not. It's just like they said, they responded to this community in the midst of this pandemic because we were dying 4 times faster than people who don't look anything like us. You talk about COVID fatigue. I've been a physician for 25 years. And I can truly say in my 25 years of this profession, I have never experienced burnout. By the end of last year, I was done. Every day, I went hour on hour. I was getting bombarded with questions. And I have never said, I don't know so much in my whole professional life, because I just didn't know. This was new to everyone. It's just as soon as you were getting information, I was getting information, and I was trying to dissect it and be able to kind of be able to regurgitate it to my patients. But because it was happening so much, and again, I'm seeing people die left and right. I can't even tell you how many of my patients passed from COVID. I can tell you I've had 2 personal friends die from COVID. So the impact on not just the society, but the people who are providing care, and even to some degree, the government, everybody is feeling the fatigue from it. But until we get it under control, we got to keep our feet to the ground and kind of deal with it so we can get rid of it.
Thank you for that, Dr. Johnson. And that, I guess on that note, we'll conclude that. I think that all of the perspectives were very insightful, and it just shows like the differences in perspectives across the generations. That's why we're having this conversation. So I'll leave it to you, Cassandra.
All right, so let's move on to another question. And for the next few questions, let's do it like a rapid round. We'll try to have 2 people per question to answer these next few questions. And we want to give an opportunity for those that are in attendance. We'll be able to ask some questions as well during the Q&A. And so I have another question, and specifically going to Pam Davis and Dr. Christie. What does community migration mean? And so if you two can give us a good response for that.
Well, this is Pam Davis. Hi. My understanding of it is it was a set of actions that the people in the community needed to take to slow the spread of COVID-19 and its infection. And the goal is to slow the spread and protect individuals at an increased risk for severe illness. That's why every time I would see on the news or on a social media, people gathering, even before it was social distancing, people gathering, knowing that we were in the middle of a pandemic, it just made my skin crawl as a nurse. And I'm like, we are told not to do this, but everybody, social media is horrible because everybody wanted to show, I don't care if it's COVID, we're still out here partying. It's a COVID spreading event. I just didn't understand that. So that's what mitigation means to me, to not do those things. Dr. Johnson, if you can help me with that one.
You absolutely hit it on the head. The key thing is to kind of mitigate it within your own communities. And the conversations that I always had, it starts at home. Because you had to kind of have the philosophy and understanding in your household so that you can kind of take it in the community. And it ended up being just the tiny facts that individuals needed to know so that, again, we can kind of prevent it in our homes, therefore prevent it in our communities and in our surrounding settings. So it's exactly what she said.
Thank you. Great responses. Moving on to the next question. For this one, let's hear from Brandon. Haven't heard from you in a little bit. Let's get your perspective out there. And let's say Richard and also Dr. Sizer. So love to hear from you. What is your response to family, friends, and coworkers when asked if they should get the vaccine? Starting with you, go ahead, Richard.
My reaction. So, I mean, it's conflicted. I'll be telling them about the vaccine and about how we are ingrained as Black people to not want to take a vaccine from the government due to the Tuskegee experiment. And like, it just be mixed reviews. Like, my friend group, like my close friend group, I think all of us is vaccinated, but 2 of them, because they just don't believe in it. They not trusting it at all, but their family is vaccinated. And we be trying to tell them, like, you should go get vaccinated. Or I'm like, no, bro, I'm cool. Like, nothing not going to happen. I already had COVID. And I was like, that's not a good mindset to have. And you work with children, so you should get vaccinated. No, I don't want no vaccinated. So it just be a constant argument or to prove a point, like you should get vaccinated. Like, yes, you may think the vaccine is bad, but it's do more good for you than harm. So it just be different. And then I think people are realizing it now because like some of the family members are getting sick, or people I know personally are now getting sick, and now they're going to get the vaccine because it was like, all right, so my uncle, he in the emergency room on a ventilator and everything, he was a healthy individual, but he didn't believe in the vaccination. So now it's like, okay, I should go get the vaccination. So I think it really depends in our generation on who might be affected too in your close family. I feel like that's the only way that will make people to go get the vaccine.
That's an excellent point. I'm so glad that you brought that up. Dr. Sizer, over to you.
And I definitely can continue exactly what Richard was saying in terms of how do we convince those who were opposed to getting the vaccines to get the vaccines. So one of the main things that you want to think about, again, this is a vaccine that can be spread through those mitigated communities that are out partying and having fun. But at the same time, if we look at our own personal generation, our own family, friends, colleagues, we want to make sure that we're not one of those individuals that are spreading that COVID amongst them. And also we have to think about the individuals, especially for those who work in the healthcare profession, we have to think about how we could actually be spreading that virus amongst those individuals who are already compromised medically. So it's just the idea that I can speak for myself. Yes, I got it because it was mandated, but I also thought about my children who are both working in a healthcare environment, that I don't want them to be exposed to other individuals who are not vaccinated against COVID. And then when you hear about the stories of the individuals, unfortunately, primarily it was our Black families and the elderly who have died from various other medical conditions that they may have had, but it was exacerbated by the fact that they received COVID. So our population has been downgraded through the environment of them getting COVID, and we've lost a multitudes of people. So initially, no, I did not want it, because in the beginning, I didn't trust the science, because I will admit that I did not research it as well as I should have under the circumstances. But when you find and you hear that you've lost so many of your loved ones, so many friends, people who've lost individuals, it's one of those things. Going back previously to the conversation that we had when we were younger, we got the vaccines because that's what we had to do. So I guess I just don't understand under the circumstances, because this is a pandemic. This is not like, we stubbed our toe and, it hurts. This is killing people. So if nothing else, we need to take into consideration, we are losing our loved ones. Our population of Black and brown people have been decreased substantially. So it's just the idea that we all want to think about, how can we assist getting individuals vaccinated to help maintain our Black and brown people.
All right, final one on this question will be Brandon.
So coming from the lens of somebody who's unvaccinated, so like I do have this conversation a lot with my family members, because most of my family is vaccinated. To be honest, like the first thing I do say to everybody is like, it's your body, your choice. However, I think a big part of this conversation we need to have is risk management. So pretty much every decision you do does have consequences with it. So it's one of the things, if you are like with me, so since I haven't got vaccinated, like one thing I do is I get COVID tests 2 times out of the week, every week, just to make sure that, I'm not getting exposed to COVID. And if I do, I make sure I put myself in quarantine, and I try to do other risk management things to kind of deviate from, trying to get COVID. So like I do see that COVID, getting a vaccine does help the chance of catching it or the symptoms of COVID. However, I think the risk management part is more crucial at the present moment, from my personal opinion.
Thank you. Thank you for adding that. For those that are in the chat or those that are attending, whether you are on Facebook or here on our Zoom account, remember to go ahead and start dropping any questions that you may have in the chat so that we can address them during our question and answer session. Also, if you are posting about tonight's event, remember to use hashtag Good Health Lens and hashtag NCNW DelVal. Over to you, Janae, for our next question.
Thanks, Cassandra. I feel like Brandon was reading my mind because of the next question that I'm about to ask. But I would like to first direct this to Sierra, just because I know about your background. What are, aside from getting the vaccine, I know you opted not to, but what are some of the things that you're doing to protect yourself from COVID-19? Whether it's what other alternatives do you partake in to protect yourself?
Really good question. So for me, I think one, because I am a nutritionist, that I really believe in the importance of our diet and the impact that it has on our health. And so one of the things that I think it's important for me and for everyone else would be to make sure that we are eating, healthy. And what does that really look like? It is making sure you're eating a variety of fruits and vegetables. There's a thing that I like to say, like, eat the rainbow. Are you eating the rainbow? And the reason for that is that because certain fruits and vegetables have certain phytonutrients, the different colors means that they're going to be beneficial for different things. And so, a lot of fruits and vegetables, they have antioxidants, which are really beneficial for your immune system. And so just making sure that you have a well-balanced diet, making sure you're eating whole grains, making sure you're getting a good source of protein, making sure you're eating some healthy fats, making sure you are limiting your processed foods. You're not eating a whole bunch of things that are, that comes in boxes. You want to make sure that you are, limiting your sodium intake. And, a lot of times we like to go for the packaged meats, and those are going to be, they tend to be higher in sodium. So you want to make sure you're limiting. Okay, Cassandra. You want to make sure that you are limiting.
Feel attacked.
It's okay. It's okay. It's like you just start small. You know what I mean? Small steps can lead to big wins. So you just want to be mindful of that. And so, like, for me, just making sure, making sure that I have a well-balanced diet. I know also during the pandemic, because we were indoors and, we were doing a lot of things like eating out. We may have been eating, drinking more alcohol. Like, you want to be mindful of your alcohol intake as well, because that also suppresses the immune system. And so even if you are, participating in like binge drinking for like a week and you're like, oh, I'm gonna go out with the girls and I'm gonna just have a couple of drinks, like, though that small amount can also still impact your immune system. So those are just like some of the things, making sure I'm getting enough sleep, making sure that I still am, wearing my mask, washing my hands, doing things like that. Physical activity is going to be really, really important. So making sure that I'm staying physically active. One of the things that I like to suggest to my clients is, like, if you find it really, really hard to exercise after every meal, if you're eating breakfast, lunch, and dinner, take a 10-minute walk after that. You've done 30 minutes for the day. Real easy and simple to possibly get in. Making sure that you are drinking enough water. That's really, really important. And especially as we head into the, the winter months, we can lose water because of the dry and the heat being in the house. So you want to make sure that you're drinking enough. And then I think in general, addressing stress. If you tend to be stressed, and I know it's so much easier for Black and brown folk to be stressed because of the superwoman syndrome and, it's just a lot on our plates. And so you want to make sure that you are doing something to address your stress. And if you don't know, think about what your stress triggers are, and then start to find some things to mitigate those, and sit down and think about, okay, what can I do to, work on this or fix this, practicing self-care, just like little, small, simple things that you can start to do to improve your stress. Because what happens is, when we are stressed, that definitely impacts our immune system and our ability to be able to fight infections. And so if we're constantly stressed, our immune system is not going to be there to support us the way in which we would need it. So definitely making sure we address stress. Trying to see if I'm missing anything like specifically that I do. As you know, Janae, so because I am an integrative health professional, some of the things that I like to incorporate, which is not always, because my mantra is generally always food first, and doing some of those lifestyle changes. And I know, like, sometimes people, you hear that your homegirl tried this or they did that. So the first thing you do is just go buy the supplement. You don't even know if it interacts with your medications and if it's going to cause any issues with you. And so I don't really like to use supplements a lot, but also understanding that sometimes the bioavailability in, certain fruits and vegetables that we're eating, and if someone's not absorbing the nutrients because there's dysbiosis, we have to kind of sometimes get into supplementation. And so that may be, using some like antiviral herbs, or it could be, supplementation with some of the like important nutrients that are really going to be helpful for your immune system. And so just kind of like the little integrative approach there that I typically use. Not giving too much. This was all educational purposes. This information was for educational purposes. Please talk to your healthcare provider about the things that you need to do specifically for yourself.
I feel like since Cassandra called you doctor, there goes your dissertation right there. But Cassandra, I'm gonna pass the mic to you for some additional questions.
All right, so we are going to jump into some of our Q&A questions. And again, if you are attending, whether that is on our Facebook page or if you are here in Zoom, please drop your questions in the chat. So the first question that we have, which is a good perspective, what impact does religion have on whether you should get the vaccine or not? And maybe it might be helpful to add, people of color often practice a variety of different religions. And so there are so many different religions to consider as you are providing your response. And so I'll open the panel to open the floor to any of the panelists to respond.
Okay, so I'll take a stab at that question. It's pretty loaded. So pastoring a young Black millennial church during this pandemic has been very interesting. Believe it or not, so I don't even know the words to put into this one. Believe it or not, so for the Christian belief, that's what I practice. We have actually seen a rebellion against the vaccine, believe it or not. It is more of a God is going to heal me. I trust God. I don't need man-made vaccine. And, that's okay. Yes, God can do a whole lot of things, but we still have a accountability that we need to practice here. And I think what the conversation that I've had with, our young millennial church is, you don't want to get the vaccine because God can heal you. However, we overeat like crazy. And so I'm wondering, are we asking, God to do these same things that by our own hands that we do? So I've seen a rejection as far as the Christianity belief is. It's a I don't need the vaccine, or I don't want to take the vaccine. It's my freedom. It's my choice. I don't have to. And it's because, God is going to protect me and God is going to heal me. My father actually, because I was not with the vaccine when it first came out, I was slower to make that decision. And my dad asked me a very simple question, because I was telling him about God and I was letting him know that the Lord was going to take care of me because he has protected me. And my dad said, is he not the same God if you get the vaccine? And I was like, that was a really good question. My dad is 60 years old. He's considered a boomer. And when he said it to me, it just like a light bulb went off. And I was like, that was for me. It's like, yeah, I guess he's the same God, whether I get it or not. So just from that perspective, as a young Black pastor, pastoring a young Black church, and I think somebody said this earlier, a lot of it's political as well. So a lot of my congregation who are Democrat they are vaccinated, and then my other half of my young congregation that is Republican, they are not. So it kind of just depends on where they fall politically, kind of gets intertwined with the religion decision.
Excellent point, which goes to some of the points that were made previously. So thank you. I see Sierra has some thoughts.
Yes, I don't know why I feel compelled to answer this question, but I will say this. So I have been to seminary. I have a master's in Christian education. And I think in my seminary experience, the way I view God is now in a different way, right? And so with that being said, I think everyone has their own unique relationship with God and how they worship, how they practice, whatever their beliefs are. And we all come from different faiths, right? Or different religions and different belief systems. And so who am I to tell someone that this is how they need to view or see God or interact with God in particular way. And so because I have that perspective, I think when it comes to the religion piece and COVID-19 and certain people, you know, using God or their religion as a means to say, well, this is why I'm not getting the vaccine. I think from my perspective, it's just pro-choice. It's like, look, I respect what your choice and decision is as to what you would like to do to your body. I cannot shame you or condemn you for making this particular choice that is best for you. And so I think in regards to religion, I think, you know, there's definitely some misinterpretations of the Bible and all the things of that nature. But I think that's like a territory where it's like, hey, who am I to say that you should be doing X, Y, and Z as it pertains to religion? So.
Thank you. Anyone else want to jump in on this one? Or actually, I'll just go ahead and send it over to Janae for our next question.
So I know that, thank you, Cassandra. So I know that there was a concern or even a comment in the chat about how the vaccine was developed and the fact that there are not always Black and brown people in studies. So how does that matter in vaccine development? Or just in medicine period. So I know, I don't know if folks are really on like TikTok and Instagram, but there's like a medical student, a Black medical student, and he does TikToks about how basically about discrimination and racism in the medical system, and how even when their doctors are taught to how to identify certain ailments in people, how they may appear differently in white skin compared to Black or to brown skin, right? And so even we're talking about vaccines, like how important is it to make sure that we include a diverse group of people when we're partaking in these studies? I think we threw a curveball, Cassandra. I don't know if anybody wants to answer the question. But I'll just say, like, I just think that, oh, you're on mute.
Oh, sorry. Thank you. Is it maybe, is there a way that we can reframe it or rephrase the thought is, have any of you been involved in any studies ever? Do you think that it matters to have Black and brown people on studies as they're developing medicines or treatments or anything like that? Maybe there's a connection there. All right, there we got something.
I was trying not to answer this. I was a research coordinator at Penn, and try as I might, being Black patients would absolutely refuse to participate. The data is skewed if you don't have different people, different populations. And so I personally feel that it is essential that Black people be involved in studies because we may react different. Many of the tests are made on white males. I'm going to use the drug lisinopril, which is for blood pressure. White people can take lisinopril, no problem. Black people take it. We swell up. We have an ACE cough. It is not a drug for Black folks most of the time. So if there are not Black people who were involved in the test when the FDA was doing that, then they don't know that we react differently to it. So I personally feel that it is essential that Blacks, Latinos, Asians, we're all different sizes, shapes, colors, be involved in research studies so that we have better understanding of what works for us and what doesn't.
Sierra, thank you for that. Ms. Carolina.
So I think definitely I would just want to echo, I think it is important. And one of the things that I kind of encourage my clients to do when we have questions about medications is, when you are discussing a new medication with your healthcare professional, ask them the questions about, hey, who was this, medication tested on during the trials? Was it someone that looks like me? Was it someone that has the same health conditions that I have? Was it someone around the same age? Because I think all of those factors play a huge role in how certain, medications may interact with our body. So I think it's important for us to even come to the table and ask some of those questions. But I also will share this. So I work with the homeless population and, just underserved folk in general. And a lot of them actually participate in studies. So they tend to also target some of our population where we may not have the educational level to communicate in a way that we are comprehensive of what's actually happening. And so we actually have to have conversations with my population to say, okay, what's actually happening in this study? What are they doing? And we may even go over some of the paperwork with them so that we can just make sure that they actually understand what's happening. So I do think that it's not happening to the extent in which it should, but they definitely find a way to target us, to pull us into some of these studies. And they generally choose some folk that may not be able to, understand what's really happening and what's going on.
Yeah, and I hate this term, but let me piggyback on what Sierra said. So I was actually, while I was in grad school, I was actually a part of a research project where they were surveying pregnant women and postpartum women for postpartum depression, and they were comparing the results of women who were diagnosed with HIV versus who weren't. And so one of the questions was, I feel content. And so a lot of the women that participated, they didn't necessarily understand what that meant just because of maybe reading level, what have you, right? And so even something as simple or something that we think is so simple as that question, I feel content, opens up for a wide variety of interpretation, right? So let's say if they ask the interviewer, what does that mean? I could have a different interpretation compared to Sierra or compared to Cassandra or compared to Dr. Lowry. So it's very important, like you said, Sierra, to kind of know who you're dealing with and to meet them where they are. And so I just wanted to add that tidbit. But we're going to have Akua wrap us up to answer this last question of our session.
And there's also a follow-on question in the chat from Christina Harris. And let me just click on it real quick just so I can see. Christina mentioned a lot of the great things that you all have been mentioning, which is just it is important to have Black and Brown folks involved in medical testing, but what steps need to be taken for Black folks to participate without feeling like they're being exploited? And so just something to add in as Akua, you're helping us to wrap up this question.
Yeah, so again, super interesting because I am a double social science major. So a lot of the perspectives on this call are just completely different, right? Because I'm looking at the same problems from basically just a different viewpoint. But I think something that's super important and something that oftentimes because there is this harsh line between hard sciences and social sciences, we forget to remember is that I don't really know what we specifically called it, but observation research, right? And things like that. So everything doesn't need a clinical study, right? So a lot of things do, and a lot of medicines do, and a lot of things in health do need a clinical study and a research and controls and things like that. But also doctors listening to their patients, right? I think so many times we get the study and we go off of that, right? So we say, this is what's gonna happen. And so when you go into the doctor and something else is happening, it's oh, it's not that, let's move on, rather than, let's explore every possible option, right? And that is a lot of work, right? That's a whole different realm of work. And that's why I think that line needs to start to dissolve between hard sciences and social sciences, because I think there could be some collaboration there that could be really, really beneficial. But yeah, I just think listening to patients or just talking to people, right? It doesn't always have to be a come in controlled study, take this drug, this one is a placebo. It doesn't always have to be that, because Black people specifically, not necessarily to, make us, a monolith, but we don't trust that. I'm not going to walk into a room and put a gown on and let you pump me full of drugs that I don't know what's going on, or you tell me what's going on. And I might be getting paid, but it's not a whole bunch of money, right? And so that's just never really, in my mind, specifically for me, that's never going to go for me. I'm never just going to walk in somewhere and be like, yep, I'm ready. Because I'm scared of that. Like, that scares me. And so I think just like, again, like we can see this in therapy, we can see this, in different realms of science, but like just really listening to patients and listening to people, because people know themselves better than, it's weird to think about, but people know themselves better than doctors and scientists and everybody who's working with them, right? Because they live with themselves. They are experts on themselves. That's what's going to happen. When they feel something's wrong, they know something's wrong. And you telling them nothing is wrong is not helping them, right? And so maybe you telling them that we're going to, try to figure out what this is and see if other people or other patients that are experiencing other things or are from other demographics are also experiencing these things, and, taking that extra step rather than, if you don't check out all these boxes, this is it. And then my last comment is like, this is really, really important to me. I was actually doing a study on this about like BMI and like body mass index and stuff like that. Like, I was one of those kids who always went to the doctor and she was like, you are overweight. And like, I was tiny. I was super tiny. I just played a whole bunch of sports and I was super muscular, right? But because of the chart and what the chart said, I was overweight and I had to eat like this and I had to do this. And like, that just took such a toll on my mental health. And that took such a toll on like my identity as a child, because I'm being told something, but like, I'm not actually experiencing it. And so it was this hard thing. And so I was going off the charts that were based on white girls. That's what was happening, right? They said, because you look like this, you're not lining up with what a white girl is supposed to be. And that's exactly what we're seeing here, is that like, we're just consistently being compared against people that aren't looking like us. And so why not, if you see that all these Black women are not lining up to these standards of body mass index, maybe the body mass index chart is the problem, right? Not the people. So yeah, sorry if I'm yelling. My apartment just kind of echoes, but yeah.
No, you're perfectly fine. And that kind of delves into kind of what I was talking about earlier. But not only do we have to ensure that we have doctors that have the similar backgrounds as us, or even doctors that are culturally competent, even though that's a loaded term too. But we also need to teach our folks how to be advocates for themselves when it comes to going to a physician or going to a medical professional. But I really appreciated this conversation. Thank you, Akua. And so I'm going to pass it over to Cassandra while we wrap up.
All right. What a wonderful discussion. We started this off saying, can we talk? And we sure did. And so we heard such great perspectives from all of our panelists tonight, from so many different areas. And I think that someone hit the nail on the head when they said Black people are not a monolith. That means that we are all different. We come from different perspectives. We have different thoughts. And so it is absolutely wonderful to have such a wide variety of people come together and share some common thought, but also share some differences, and us be okay with that. And so thank you all. If you can please give yourselves a round of applause. I'd like to move into a quick, what in my office we call, oh, by the ways. So let's wrap up tonight's discussion with our oh, by the ways. Any oh, by the ways from you, starting with Brandon. Oh, you're still muted, Brandon. There you are.
Sorry about that. Oh, by the way, you guys did a great job. You enlightened me, and you kind of gaining more information, especially from a lot of Kings and King Richard. You guys gave me a lot of uplift, and I would take that this knowledge and really apply it and further these conversations within my inner circle. So thank you.
Thank you. Moving on over to you, Richard.
I just want to thank you for inviting me to be on the opportunity to speak on my behalf of my generation, as well to talk about my peers on what we deal with and go through. I want to thank Miss Juanita Jenkins, everything where I'm at because of her. She helped me a lot. So I owe it to her. And Brandon, me and Brandon are close friends. We was actually talking last night, but I didn't want to tell him what I was going to talk about because I know he wasn't vaccinated. So I said, I'm going to come with some information to help you out. So I just want to thank y'all for everything. There was a great conversation. And I also thank my executive director actually just sent out an email 10 minutes ago talking about can we talk on a national level with Kappa and NCNW on a national level, I believe. I was just reading the email and I was like, oh. So I think they have something planned for October 27th. I
Yes,
believe on
sir.
Facebook as
You're
well.
absolutely correct. Thank you.
You're welcome.
If they sent you a flyer, you can most definitely drop it in the chat for anyone that has access to that.
Okay.
Let's hear next from Ashanti.
Oh, by the way, this is amazing. I love conversations like this. Huge shout out to my aunt, Dr. Doreen Lowry, for inviting me to be a part of this panel. I just think it's amazing when a bunch of educated people can come together and have a great level-headed conversation, and I think respect all of our opinions and decisions. I think that this is where this needs to start. If we can, as a community, keep this going, I think we'll have tremendous results.
Absolutely agree. Thank you. Thank you so much. Carlina.
Oh, by the way, we boomers are a pain in your butt. I know we won't get out of the way, but we love everybody. We love the millennials because who else would have come up with what's that? The avocado toast. And when we can't get on our Facebook page and we can't figure out how to open something, thank God you all are there because you know how to do everything. I thank my president, the first vice president, for inviting me to represent the boomer generation. And we will try not to dictate like we've been doing. Love you all.
Thank you. Shout out to avocado toast though, always. The real discussion here. Let's hear from Pamela.
Oh, by the way, thank you for inviting me to join this panel. It was a very good conversation and I hope to be invited again. And one more thing I just wanted to add that I didn't get to say, I raised my hand, but I guess you guys didn't see it, is that we also need to consider when we're talking about research and African Americans participating is literacy levels. When you go to the doctor, research paperwork is a multitude of information. A lot of people they can't read it. So people need to understand, they need to take the time to explain. And I think they get frustrated and that's why they don't participate. Black people don't participate. I meant to say that earlier, but thank you for inviting me. And I hope I get to join again.
Thank you. Excellent point to add. And I think that we really have to do a better job of making sure that we're all on the same page when it comes to that. So thank you so much, Pamela. Dr. Sizer, I keep saying doctor. I'm calling, everyone gets a doctorship. So nurse, go ahead, Ms. Sizer.
Actually, my doctorate is in nursing practice. So you're absolutely correct. But I wanted to piggyback off of what Pam mentioned in terms of the literacy level. I actually did my dissertation on literacy and using the teach back method to ensure that, especially our brown people, but all people, because we can't discern the literacy level by looking at anyone by sight. So it is very important that we take notice to, especially those in the healthcare profession, if we give them documents or paperwork, that we observe how they're looking at that, because that's a red flag. If you think that they're reading that, but you notice that it's upside down, that's our opportunity to say to them, let me help you with that, because that may be someone who may not understand the words written on that paper. So we just need to clarify and understand that literacy, unfortunately, is high amongst our African Americans, especially our older senior citizens. So, oh, by the way, I do appreciate you inviting me to this panel. And yes, I will definitely be available for the next one when it comes up. Thank you so much.
Thank you. Great additions. Thank you very much. Over to you, Akua.
By the way, unpopular Gen Z opinion, I do not like avocado toast. But I think that's a white people thing. But what was I saying? I would not be a Kua if I did not say radical empathy. So like, I was super excited to be here. I love stuff like this. You know, I hate that it's on Zoom and I hate that we all can't be in the same place, but at least gives us a chance to connect people that like probably wouldn't have been able to be connected before. I'm in Cincinnati. Most of y'all are in Philly, things like that. But yeah, like radical empathy is just like what I do, what I live by, what everything, like my friends just get sick of it at this point. I'm like a broken record, like radical empathy, radical empathy. But like, I just want us to acknowledge that like we sat here and we listened to each other, and we're gonna go and like understand these perspectives in new ways now, right? So like that doesn't mean like our opinion is gonna change or our perspective is gonna change or anything that we're doing is gonna change, but like our mindset is, right? And our understanding of other people and our understanding of not only our community, but other people that are impacted by our community. So I feel like that's really cool. And I love that a lot. I think that was it. Yeah, that's it. Thank y'all.
I love you. Thank you. Over to Sierra.
Hello. Okay, so oh, by the way, I think we are doing a really great job of, pushing the vaccine to make sure we're trying to keep our communities healthy, but I still think that we need to address the health of Americans in general. I feel like we've had too many people die from COVID-19 due to complications from, having these comorbidities. And, to be honest, some of these chronic conditions could have been prevented. And so I do think that, we need to continue to have conversations like these, but I would like for the conversations to also talk about how we can help our folk that have diabetes. What can we do to change the health and the health status of Americans, and specifically for Black and Brown folk who have been impacted by COVID-19. I have been paying attention to the death rates in other countries and looking at China, and to see that they've only had about 4,000, 5,000 deaths out of their entire population, and it says a lot. And so I think we just need to really address what is happening here in America with our food system, with our medical system, and all of the things. So I really enjoyed this conversation, glad to have been a part of it and to hear the different perspectives. And yeah, thank you.
Thank you. Wonderful points to add to the discussion. And as we come to our follow-on, it's probably something we should really address. So thank you for that. Moving on to Deanna.
So, by the way, thank you for having this in the first place. I think that these types of conversations are extremely important, in that, especially in the Black and Brown communities and marginalized communities, that it's important to have this and have the free exposure to this as well. So I thank you for having that and allowing me to be a part of this as well. And I learned a lot from a lot of very prestigious people on this call. So I appreciate that very much.
Thank you. I believe we have something else that Brandon would like to add on.
Yes. Oh, by the way, fellas, you can join NCNW. Me and my brother Richard are the only 2 males in this chapter. You can sign up. We need some more males. The Queen's holding it down, but us, we got to do our parts too. So, if you know any males, tell them to join with us. We can have a little Zoom kick it sessions or whatever. But fellas, you can join NCNW. We have to support our queens like they support us. So I just wanted to say that real fast.
Such an excellent point. Thank you. Thank you for adding that. So for our, oh, by the ways, I think, did I get all of our panelists? I'm scanning, I think. Did I miss anyone? All right. Thank you so much to Janae, my fellow co-moderator. She's been amazing. And we would like to pass it over to our Madam President, Juanita Jenkins, to help close us out tonight.
Well, I could not. Everything that was given to us this evening is just, it had such a depth of impact and reverberation. And I have to reiterate, this is the first, and it will not be the last. So for those of you who are on our panelists that know that they want to stick around and would love to be able to facilitate conversations, our first Vice President, Sister Dr. Doreen Lowry, will be following up with this conversation with Purple Table Talks. And that will be coming forth within this program year, along with additional conversations. And I want to go ahead and continue to speak to my soror, Sierra, mentioned that there are additional, this is the first of year 5, the first year of year 5 with Good Health Wins. And we will be working, so obviously because we're coming out of this pandemic estate, the first year, everything is about COVID COVID and making sure we're alive to see the next 4 years. But we will be also addressing other health initiatives that impact explicitly Black and Brown women and girls within our society. So yes, please stick around because we definitely want to continue to have these conversations. And the hope would be is that one day we'd be in a room together to be able to kind of touch and see and pick up the nonverbals and help with those teachable moments when we can get together in the place together. And so I just want to encourage that if you, as my young our male members have encouraged, yes, membership in our organization. This is indeed what the Delaware Valley section is about, is bringing together community. I love the fact that we hit on that, because I've been saying for a couple years now, the only way that we are going to survive what is happening within our government is if we get more community minded and community focused, and we keep this thing tight. We have to. It doesn't matter what they're doing. What are we doing is what's first and foremost what's going to dictate our survival. And so one of the things that actually came out of what are we doing is the establishment of this section. We are just 1 year old. And so with you as our panelists and our viewers on Facebook, we can move the needle forward and continue to bring education, continue to bring awareness to the issues that plague our community. So I do want to encourage you to join us as a member. In the chat, I believe you'll see the website. You can visit us on our website to find out more about the Delaware Valley section, as well as I believe the joining us tomorrow. Our section meeting happens at 11 a.m. We'd love to have you. So you can find out a little bit more about what we're doing within the Delaware Valley, what our plans are for the Delaware Valley. And I would like to once again thank our sponsors. Thank Tiana Phillips, president of the National Panhellenic Council of Southeastern Pennsylvania, Valerie Fields, also Vanessa Fields, my apologies, of AFSCME Retirees and National Organization of Women, Jovita Hill, also the executive director of the Philadelphia Women's Commission. I would like to thank all of our sponsors and our attendees for being with us this evening. And I just want to close by continuing to let you know what we're about. We promote education with a special focus on science, technology, engineering, and arts and mathematics. We encourage entrepreneurship, financial literacy, economic stability, educating women about good health and HIV and AIDS, and promoting civic engagement and work to be advocates of sound public policy and social justice. And so tonight's program is an outpouring or outreach of those, a few of those initiatives. But I want to encourage you, join us for the rest. Join us as we move towards and in this new, brave new world that we are constructing by our hands, by our own space to really move the needle forward for our community. And so without further ado, I just once again want to thank our attendees. I'd like to thank our moderators, Cassandra Luberis and Mike Soror. Janae, I thank you as our moderators. I appreciate your commitment to this endeavor. And I'd like to once again thank our first vice president, Sister Dr. Doreen Lowry, for her labor of love. Indeed, this is her labor, and she has been laboring with us and our tech chair, Sister Dr. Valerie Dudley, who will always ingratiate her, let us know where she stands within this technology game. But she commits all the way, and I appreciate her more than anything. And Laura Reddick, I'd like to once again thank her and for all the work that she's been doing to commit to this project, as well as many others as our media relations and outreach chair. Patricia Williams as our recording secretary. I'd like to thank her for always being Johnny on the spot and the receiver of many CC'd emails. And so without further ado, I'd like to see you all, hopefully, if you bear with us tomorrow at 11 a.m. And I'd like for you to go ahead and enjoy your evening.